she's worn out the treads in the front of her shoes, and the entire toe box, you can see the treads here very clearly. They're all worn away almost to the midfoot, where you can see she has tread here, doesn't have tread. I mean, she has tread here. She has very little tread here and has no tread near the top. This is as a result of a 4/5 foot drop. Over 30 years ago, in 1994, and now it's 2025, this woman had a stroke. And how old are you again?
36.
36. I know. Anyway, what's unusual about her is, were you more affected than just your foot initially? Did you have trouble talking, or you had trouble with your arm?
Initially when it happened, my whole left side, arm, leg just went numb.
Numbness, yeah.
It went weak. And my speech was kind of monotone.
Yeah. But the thing you've noticed the most over the years is his toe has remained in an upright position, which we now know is a striatal toe that has to do with her stroke involved her putamen and caudate area, and it makes this muscle spasm a bit, so it's always in the up position. And she has had issues with, despite this being up, her foot is weak, so occasionally she gets into a steppage gait and hits her toe and injures herself. Checks her strength. You're going to pull this towards your head, and I'm going to pull down. I'll try not to cover it. 1, 2, 3. You pull, I'll pull. And you can see she gives. And over here, pull it all the way up. 1, 2, 3. And she's like a rock here. And you can see my arm's pretty against my bicep. Her ankle's doing a good job. And over here,
Biceps pumping up.
same thing, pull it up. Towards your foot up. And see, watch my bicep will tend up, but I'm able to overcome her.
Yeah.
So here's her good foot, and bend it towards you, and she gives me good resistance. So again, I can do this kind of stuff,
Strong.
very strong. Go over here, pull this up towards you, and now she also can give me good resistance. But side.
I got it.
We'll even have, we can have Amy guess which foot is the bad one. All right, so this one you're going to fight me.
It's my good one.
Now you gave it away. Okay, pull it up towards your head, and I'm going to try to pull it in. And you can see it's pretty darn strong. I'm leaning a bit. And I'm going to do it this way. Well, this really covers it up, doesn't it? So you can't really see anything. So this is the better way to show it. Or even down here, I don't have to cover the toes. You can see how strong it is. Okay, now we're going to do this one. Pull it up there, pull it your toes toward your head, and don't let me push him down. And again, I can hang on this. This might save a life. Paul's hanging by. And I can push it, and if I push it just here, even here, I can't bend it. So I can't tell the difference in strength. Does it feel very similar to you, the 2 feet? I mean, they don't feel much different?
They feel better. Last time there was a big difference.
Yeah.
I was like, whoa, I have no strength.
Yeah.
Now I'm...
Yeah, because over here, I'm going to do them both at once. Lift them both up, and I'm going to try to pull them both down. Oops, towards your face. Okay, you can see I can really lean on these guys because I'm now giving you some of my weight. So that's really good. I don't think that anybody could tell. Any doctor examining you would not see a difference.
That's good.
Okay,
Yeah.
so we did
Okay.
that. Perfect. Here we are with Jane and Paul, and what we're trying to demonstrate here, she's doing much better, but we're showing her old shoes, and you can see on the left foot how she wore the tread out of the toe area, and that's due to her catching her foot with the foot drop. And this is something we see in foot drop patients all the time,
that's why they kind of stumble forward a lot. And we'll ask her, how does that feel when you actually run into your foot getting stuck on something?
Horrible.
Horrible.
I feel like
Whoops. You feel like you're gonna fall.
I feel like I'm gonna fall. I feel like I'm drunk. People think, what's wrong with her?
And then, and then you gotta regain your balance.
Yes.
So how's your, actually, Paul, why don't you come over here, we'll get the, the patient, and then you can see what you've observed. So what have you observed, you guys, this is more than a month ago.
Yes.
And it took a while, because it was almost 20 years that you were walking wrong. I mean,
Definitely.
so it's a lot to relearn.
1994, yeah, 20 years.
Yeah, so now you're walking, you've relearned how to walk.
And consciously,
Yeah,
heel toe now.
yeah, and
And it's much better.
Much improvement,
I don't
yes. She hasn't
scuff
tripped.
and drag.
She hasn't tripped in all of her walks when we were in North Carolina. She didn't trip,
No.
not one time. So.
are those
But
like
I
hiking trails?
consciously-
Some are hiking trails and uneven ground. Some are flat in the park.
Wow.
Would you say you would notice her trip like once a week, once a day, once a month? I mean, she would
I would
notice it more.
say, depending on how much she was working out, sometimes it could be as much as a couple times a day.
Yeah,
At least once a week, minimum, I would say.
Especially when I used to work out my legs at the gym,
uh-huh,
and they'd get fatigued,
all right.
and then I'd really